Alright, welcome back to Kid Focus Dentistry YouTube channel. Today we are going to discuss what to do after your child has the tonsillectomy or adenoid removed. So as a lot of time I don't feel like the information for the post-op is really communicate well with parents. A lot of time parents doesn't realize, especially with the adenoid, that it can regrow back if your child is not learning to breathe better through the nose. So just think about it. Your child, a lot of time, by the time that they're getting some kind of surgery for the adenoid and tonsil, they are usually around 7 or 8 or sometimes a lot older. Up to this point, a lot of time they will be just being a mouth breather. So this is now become what they call protective breathing. They learn this habit. They think that this is the best way for them to get air in their mouth. They tend to have their lip muscle tend to be quite weak. Their tongue muscles tend to be quite weak. So now you're cleaning out the airway. It does not mean that your child will know how to breathe through their nose. So here's some tips that you might want to consider helping your child being a little bit more aware of trying to breathe through the nose. The first thing is I tend to find the lips are weak and they tend to stay open when your child is not aware of their posture. That's usually during activity that they don't think too much about. So like playing video games, watching TV, or especially like in a long car ride or when they're sleeping. And so one of the ways that you can help your child when they are awake is to get those painter tapes where it's not super sticky on there. What you want to do is just get a little size right here and you're going to tape it right here just to remind your child for the lip to stay closed during those times. So not while sleeping, but more so like doing watching TV or playing video games. Because the moment that they're trying to open, it's going to pop that tape open. And what it does is it just kind of remind them how often their mouth is open. Because once your mouth is closed, then you automatically will breathe through your nose. So that's one of the ways that we always kind of encourage parents, especially right after they are healed from their surgery. This is some of the way that you could really help your child with that. The other way too is you take a card. They can hold it between their lips on there. Those is more so for children that are a little bit older because they're a little bit more patient at doing that. That would actually works a little bit better than just a tape alone because it is an active kind of activity. So take a card, hold it between the lips on there, and that will really help. So here's an example of a card that we have here. Again, if you don't have it, you can always ask us. We would love to give it to you. So all this is a plastic card. It's a business size card. Again, this is an active exercise. What we want to do while they're doing any kind of activity that I mentioned above, especially the car ride, go ahead and have them put it in the lips and hold. Again, if they don't hold it, it's going to fall out because this one will work the lip muscle a little bit more. However, that might not be enough for that with the lip muscle and the tongue muscle. So I will put a link down there of some of the exercise that will pertain to strengthen the lip muscle and the tongue muscle on there, and that will really help you with that. One of the other ways that you might want to consider is what we call myo brace. We do offer it here in this office, and it is a therapy that we are doing to really teach your kids how to improve on the muscle tones and awareness overall. But you know, I always recommend try these tricks first, and then if it doesn't work, you can always let us know and give us a call. Be very aware how your kid is when they are sitting. What I like to do is I always like to look at a kid in their what we call the natural environment. Not when they know I'm actively looking at them. I usually kind of look at them from the sideway, and no one is a better person to do this than you, because you do see your child every single day in all different environments. You can see if their mouth is staying open. What you can do is remind them to go ahead and close their lips on there. Again, that will make them learn to breathe a little bit better through the nose. With the nose, we think, okay, this is for breathing, but the nose is really good once it is trained. What I mean by that is the more you breathe through your nose, the better it is at breathing. So in the beginning, when your child first learns to be a little bit more aware to breathing through the nose, they might have some difficulties because they haven't really done this very much before. But the more they will do this kind of being aware of breathing through the nose, they will be much better at breathing through that. And I'm also leaving a link below to this video on the airway, the effect of airway, because while we don't think the differences in the air of getting air through the mouth versus through the nose is completely different type of air. Through the nose, it is filtered, it is warm, it is a much better type of air for your body as a whole, and it also doesn't cause inflammations. Again, this is one of the reasons why the adenoid regrow back. So I highly recommend every parent to watch this video just to kind of see the long-term effect. If, after 6 months, if they still have that tendency of their lips being open, again, consider MyoBrace. That will really help you for the long-term growth of your child. If you have any question, you can always give us a call at 303-543-8338.